The Alarica situation is the dominant challenge for us now in the country as it relates to COVID-19 and the response. It represents for us the weak link, if you will, in the arsenal and the work that we have been doing. It is going to be and is very difficult to reach all those individuals, but even more so, to contact trace all the persons that they have come in contact with. And given the extent to which we have had positive tests, it is quite clear that the possibility or the likelihood of spread by one of those individuals to their friends, neighbors, the taxi driver, the restaurant, wherever they go, the possibility for spread are real, and it is something that we need to take very seriously. Hence, the measures that have been announced by the government, by the Prime Minister, about St. Catherine. I want to just make an appeal to those persons who work with the company to call the Ministry of Health at 888-1-LOVE or 876-538-3149 or 876-538-2780, and we will make appropriate arrangements to reach to you and to collect samples. Alternatively, if you're able to get to one of these health centers, the Linstead, St. Jago, Old Harbour, Greater Portmore health centers, or to the Alarica complex in Portmore. Now we know there's a curfew on, but we're going to make provisions for you to use your ID, your identification. If you have or still have your identification, to be able to reach to one of those locations for samples to be collected. Alternately, and perhaps more conveniently, if you call the number 888-1-LOVE and the other numbers that I've just outlined, 538-3149 or 538-2780, then we will make the appropriate arrangements to reach you. It's very important, given the extent to which we have had positive cases coming out of that call center. It's very important that we reach all employees and at least have an opportunity to interview them and certainly to collect samples from them. Our intention is to test everybody, and while we're making progress, we believe our progress will be greatly enhanced if we can get the outreach or the responses from persons who clearly know themselves, so that we, the health team, can do the necessary work to support the management of this particular crisis. There are 68 BPO facilities across the country. 62 inspections were done between March 14th and April 15. 50 of that 62 passed the inspection in line with the existing Ministry of Health guidelines for workplaces, with particular focus on the COVID-19 risks. 12 did not meet the criteria and have been provided with work plans to address these issues. Even as we speak, the Ministry of Health continues to monitor and to enhance those guidelines in keeping with what was announced in the Parliament by the Honourable Prime Minister. We're working with the association to the extent that they have their members. They are also working with their members. Other operators are not members of the association. We're also contacting and working with them in order for them to enhance the standards that are required. And as was said before, to the extent that those requirements are not met, then the government will take whatever action is necessary in the public health interests of the workers, but also more generally of the community and of the country.